Okay.
Okay. All right, so this is the meeting of, what is this, October 20th, and it's virtual, and it's all available online for the viewing pleasure of our vast audience. You mentioned the minutes, Arlene. Was there anything that you wanted to suggest to change, or was it just that you noticed about the
No,
certificate?
the minutes were perfect, and it was just in your comments in the accompanying email reminding me about the certificate. So they were actually, that comment was not part of the minutes, so.
Oh, okay. Okay. Garrett, did you send Grace a copy of, did you download that certificate for the?
Yes.
Okay, and you sent it to Grace?
Yep.
Great.
Yeah, Kat,
Oh,
your
no, you were the
emails-
one who
Yeah,
did it
he
in
was
the
the one
first
who
place.
had done it. It was Noreen who ran into trouble, and
Right.
it was I who just discovered that advice tonight. So I only tonight downloaded it. So
Yeah, I
I
didn't
did.
even think of it, but now I remember when I saw Garrett had done it, I figured we should all do it.
Yeah.
We have recently had an inquiry from somebody from the Attorney General's office about clarifying a detail in our letter. So apparently that complaint is now being considered or coming close to being considered. So maybe that will get closed off pretty soon. Meanwhile, back to the minutes. Everybody cool with minutes?
Yes.
Yes.
Any objections to the minutes?
No.
Hearing none, I will consider them approved. Brad Foster is back. It seems like he's at every one of our meetings, or his projects are at every one of our meetings. This time he's having to replace his septic system. Bill Ceruta's designed it. Charlie is okay with it. Shall we go ahead and issue it? Any objections to issuing it?
No.
No.
Okay, hearing none, we will give him that permit. I'm hearing from people with outstanding projects that it's getting hard to find somebody to install.
Oh.
That the installers are booked up, and it's hard to find any more. Brad Foster's been working with Bill Ceruta on the design, and he asked me, he said, can you give me the names of any septic system installers? Because Ceruta keeps promising that, but he doesn't give me a list. And I said, well, Ceruta's one of them. He usually installs his own designs. So I don't know if maybe he's retired from that.
Wow.
A man of few words. Okay, I don't have too much on this agenda. I've received several complaints about Chuck at the post office not wearing a mask. And I went to see him one day, and I asked him I said, we don't have a mask mandate here, and I don't have jurisdiction, over a federal employee, but people are nervous and people are complaining. And could you just at least keep a mask by the window, and when you come to serve a customer, just slip it on? And he said yes, but of course he doesn't do that. And he's very agreeable, but he's not compliant. And so today when I went in to pick up the mail for the meeting tonight, he was very friendly to me, but he kept moving away from the window. So
they have the plexiglass.
Yeah, I know, but they don't really serve you through the plexiglass. It doesn't go all the way to the wall. So they stand in front of that open place. It's not like it's a barrier.
No, I'm not apologizing.
No, right.
Yeah,
But
no, I didn't think so.
I agree. There's the plexiglass such as it is. And then I would imagine that he never spends 15 minutes or longer serving any one customer. So
Well, that's
there is
true.
that. The encounters are brief. But you could say that about any, cashier type of role too.
Right.
And yet they all take precautions. And so I understand people's angst.
Yeah.
I don't think that it would amount to, it would not rise to the definition of a close contact were he to test positive at any point. I don't think any of the post office encounters would be likely to rise to the definition of a close contact, but I do understand people's angst.
I tried to search the USPS website for what their current mask policy is, and I couldn't find anything on their website. So I just did a Google search, and there was a website, called Postal Times. I don't know what the credibility of this is, but basically the most recent thing that I could find was from August that said that the policy requires USPS employees to wear masks in public-facing settings when there is a state or local face covering order or directive in place.
We don't have that.
Right. Or when an employee who does not deal directly with the public cannot achieve or maintain social distancing in the workplace. So I don't know that there's really that what you've described is that he's not acting within, if this is true based on this particular website.
Well, that last clause that you just said, for an employee who cannot maintain social distance, might apply to him.
Or when an employee who does not deal directly with the public.
Oh,
So this is between the employees, between the postal workers.
Yeah, cannot achieve or maintain social distancing in the workplace. And again, I don't know the validity of this particular news source, as it's the Postal Times. But increasingly, if you go into a restaurant, servers aren't wearing masks anymore.
Is that right?
Yeah, that's been my experience recently.
Uh-huh. Gosh, I was in a restaurant recently and I can't remember if the server was masked or not. I'll have to check on that. One of the people who complained actually asked me to call him so he could talk to me directly. And he told me that he confronted Chuck and said, "You're not wearing your mask." And the guy said, "No, we don't have to, as long as we're far enough apart." And he said, well, he was about 3 feet away from me, which didn't seem far enough. So he said, "I'm going to go to another post office." So we went down to Leverett Post Office and they were wearing masks. And they told him that there was a new directive from USPS saying they were supposed to wear the masks. So I said, we don't have any leverage here at all. If you want to go farther with it, you would have to complain to the postal inspector.
So, yeah, and I have observed that in the post office that there is a woman who I believe sometimes covers in Shutesbury, but typically works in Leverett, based on what discussions I've heard in the post office, and she typically is wearing a mask and adhering to masking.
Yeah, it's Chuck and also Diane. They just won't do it. So, in a way, it's not our problem, because there's not anything we can do about it, since we don't have a local mandate. I suppose we could, but I'm loath to go there. Any thoughts about that?
Well, the locales in Shutesbury that would be affected would include, well, first of all, there's the elementary school, which has its own mask mandate going on.
Right.
And the library.
Ditto.
Ditto, right.
Right, and town hall, ditto.
Right, and the AC, where people are eating and drinking when they're there.
Right.
And so, for instance, if you use Amherst's mandate as a model, what was adopted there was a mask mandate except for when you're eating or drinking.
Right.
So you're not required to wear a mask when you're eating or drinking. And I guess the Lake Association building, if there are indoor events there, right?
Right.
Although both the AC and the Lake Association are private. But at any rate,
Right.
those would be the locales that are affected. And I think I'm more confident in being able to work individually with the organizations that are involved with each of
It
those.
seems like it would be superfluous to have a mandate.
Oh, in the church, I guess.
Right.
So I don't know.
Well, and we really don't have any way of enforcing it if we did have it. I mean, what would we do?
That's true. That's true.
Good point.
So we
So
can
I'm
continue-
not inclined
Yeah.
toward a mask mandate either.
Okay. Wim?
We can just continue to encourage him when we go in there.
Mhm.
Okay, well, if ever you go in there,
Mhm.
point out that he's not wearing his mask, because I guarantee you he won't be.
Right.
All right. Do we want to say anything about Garrett and Noreen and I went to the After Action Conference of MAFCO, I guess, or FERCog, I'm not sure which, a couple of days ago. Do we want to say anything about that? Don't all jump in at once. Or shall we just let it go? I mean, we're going to be getting some documents and stuff from them for follow-up action. So maybe we'll just wait for that. Yeah.
Well, if there was anything really, earth shattering, please let us know. But otherwise,
It seemed to me that the kinds of things that we were discussing were, I mean, basically it was kind of going over the interviews that what's her name did, Lori did with everybody. And then there was some talk about how would we want to staff clinics in the future? Would we want to go through MRC? Would we want to rely on local volunteers? Would we want a hybrid system where they would take care of the medicals and we'd take care of the rest? And it was all very interesting, but it doesn't really seem to have anything to do with us, because we're never going to have a COVID vaccination clinic in Shutesbury.
doubt it.
So really, what's the point of considering it?
Mhm.
So that was kind of my takeaway. Noreen, did you want to add anything, or Garrett, or shall we just wait until we get documents from Lori that we're supposed to act on?
I'll just say Noreen's running on empty tonight. I had a
Oh.
procedure today, so I'm really,
Oh,
Oh, great.
So-
We're in great shape. I had dentistry today, and I think the
Oh.
Novocaine went straight to my brain. Still there.
all right, Garrett and Wim, it's us.
yeah.
I'm counting on you guys.
Oh, boy.
Based on the review session, it seems like they're going to ask us to complete a few additional things. And I think in part what they're angling toward is the fact that local communities need to update their EDS plan before the end of June. And so I think in part they want for information that comes out of that session to inform any updates that we might make to our local plan. I mean, my overall impression of the session was that it sort of didn't pay attention to the fact that we really have to, not the bigger we, not Shutesbury, but the bigger we, that the state really needs to rethink what their planning assumptions are for local communities related to mass vaccination services, and whether or not it even makes sense for a community like ours to have a local plan for that, or if
Much less updated.
right, or if we need to be thinking a bit more regionally.
And I'll just ask to add to that extent, the other thing, Kat, is there is an AAR going on with the FERCog. This was MAFCO related, this one that we went to, and FERCog is taking a look at itself with regard to COVID and seeing what restructuring they may need to do to make themselves better and to respond to, a pandemic flu of this nature. So we'll be hearing, I think they said March for the results of that.
Yeah, I think so.
I think that kind of lends itself more to, what's our role as a region or as a small county vis-a-vis, the state's perspective on how you deal with a statewide or a nationwide or worldwide pandemic. That's what pandemic means, worldwide.
There you go. Yeah. Yeah. Meanwhile, apparently we do have to do something about the EDS plan. And it seems to me that at one point, some ones of us, maybe me, was interested in basically weeding out all the bureaucratic bullshit that's in the plan and just leaving the plan itself, like what to do when. But that hasn't happened. It's not really a plan. It's a big manual for how to do everything. But let's wait and see what we're asked to do, and then we can refuse to do it. So, is there anything else that we should be talking about tonight? This may be our shortest meeting ever.
Seems to me I had something. Now, what the heck was it? Talk amongst yourselves. It'll come to me.
We did put out a message recently that had a couple of weeks of announcements around cases. Another one that we need to put out this week, or
are there cases now?
Currently, no, but I did think of what it was that I had to say, and that was that I responded to someone after the last report went out. Someone emailed the Board of Health and said, could you please publicize where it is we can get booster shots?
I saw that.
And so if it's not already incorporated into our webpage, maybe we need to or at least check into what we have for a link for the Vax Finder. It was, I think it was just a matter of directing her to this tool that we've been directing people to since last spring. But anyway, in our weekly message, maybe we could say that if you're looking for a booster, here, use this tool. And you'll see, Kat, if you look in the sent mail, you'll see how I responded to her. She seemed to be having a problem accomplishing it, but I didn't want to go all the way through the process, but I tried it and it seemed to be working fine. So I think it might have been her. She needed some tech assistance or something, but.
Do you know if she finally got an appointment?
I know, but to be honest, I have not checked BOH email today, so.
I haven't, I didn't see
may
anything
have.
from that person.
Okay.
I don't think. Let me have a look and see.
So anyway,
No.
Town of Amherst, I just had a meeting with them today, and they are awaiting supplies for the boosters. They are not at this point fully equipped to do a booster clinic, but They're waiting supplies.
Sponsored by the town, not by another kind of entity.
And
Correct.
are they going to sponsor PD clinics when the time comes?
Yeah, when the time comes, when they get the appropriate product. Yeah.
Okay.
Mhm.
And so of age Shutesbury residents for pediatric vaccination would be able to access through that?
You know, I did not ask that question, but I believe so.
Okay.
Yeah.
That
So
would be good.
I would anticipate when we send out our weekly report, typically our weekly report generates a couple or a few comments or questions from people. And I think we can probably anticipate that more and more of them will be about booster shots over
Mm.
time. So let's try to keep that tool front and center.
Okay, I'll add
okay.
that. I'll add that to the website, and then when we put out our message toward the end of the week, I will
Make
direct
mention of
people
it.
to it. Yeah.
Yep, okay. And when I kind of partially went through the process, I could see that there was a place for you to indicate, are you looking for a booster shot or an initial series? So
Mhm.
I think it takes you in a different direction if you indicate you're looking for a booster.
Okay, maybe we'll need to put a little guidance on it.
Yeah, and you might want to do what I did. I don't know, all I did was go through it, but not finalize an appointment, you know?
Well,
And-
I need to get an appointment anyway, so I might as well
Yeah,
just do it, and then I will have experience with it, and I can
right.
give,
But I
give
kind of,
tips if
I
any.
went through it as if I were a person looking for a Pfizer booster.
Uh-huh.
And I was offered all these appointments at Stop and Shop in Hadley. So,
Oh, interesting.
yeah, I just didn't finalize it. But I'm not sure what her obstacle was.
Sometimes it seems like things get stuck, not just for the vaccine business, but other things that you're trying to do online. They just kind of don't
Right.
follow. They don't carry through.
Sure.
So she may have been having one of those events.
Right. I know them well.
Yeah, I know. They're my life.
Yeah, it's the old people moment.
Yeah. Something of that.
Yeah.
I don't have anything else to talk about, really. I don't think.
Okay.
Um,
Good.
A while back, just while I'm thinking of it, a while back we were talking about trying to get a Board of Health clerk, and we were supposed to wait until they got a what do they call it, land use clerk for those other
Mhm.
boards. And so they got one, but within about 2 weeks she had quit because
Really?
it was, yeah, Lisa Stratford, she quit because it was a lot more work than she thought it was going to be.
Oh,
I think that they have divided it up in totally the wrong way, because it is too much work. I think that they should have one clerk for Concom and the Board of Health, and another clerk for planning and zoning.
Hmm.
But I'm not on the personnel board, so
No,
I
you're
don't get
not.
an opinion on this.
Yeah. Oh,
So that means they're back to the drawing board. And for some people, for some reason we have to wait for them. But I'll ask Becky why we have to wait at this
Okay.
point,
Good.
because although things aren't very busy for us now.
I know, but it would still be good to start training someone, Kat.
Yeah,
You know,
yeah,
to know
yeah.
all of
And
our
I've got some projects that I would like to assign to a clerk.
Yeah.
File management stuff and database updating stuff that would be really great if I could get somebody else to do it and get paid for it.
Yeah.
I mean, I could do it and get paid for it, but I'd rather just not do it and not get paid for it. that's my first choice.
Here. Good for you, Kat. Boundaries.
You know what I mean?
I do hear
Yes.
you.
Uh,
if I can go back for a second to, you asked me a few moments ago if there were any cases in Shutesbury, and I said, no cases. There is one child who was exposed in Greenfield and is, I think she's still in quarantine, but I'll check dates, but what day of the week would you like an update from me, Kat? So that,
Friday is good. It
Okay.
seems like they've been going out at the end of the week and we
Okay.
kind of sum up what happened this week.
all right, I think she's nearing the end of quarantine, and it sort of depends on whether the family opts for testing or no testing and so on
Mhm.
and so forth. So I will pin down when she exits quarantine and I will report to you on Friday. Okay.
Great, thank you very much.
Okay.
I had some problems with the town announce.
Oh, I saw that. Yeah.
Yeah, it was really maddening because the way you do it is you send it to town announce, and then town announce sends it back to you and says, we're ready to go, just return this with send in the message. And it wasn't returning them to me. They were just getting lost someplace. And they gave me a new address for that. And it worked one time, and then the next time it didn't. So it's just been weird.
Mm.
So I think we got it straight now.
Mhm. Okay. So our next meeting is,
November 3rd, I think.
wow, it's going to be already November.
Wow.
Yeah, I
How
know.
did
Can you
that
believe it?
happen?
I don't
What?
know.
Order your turkey. Order your turkey.
What? Okay.
Well, I was in Northampton today and it was 75 degrees. I couldn't believe it.
Yeah, I
Wow.
know.
It was
really
hot.
warm.
Today it was gorgeous.
Yeah, actually it was
And
nice.
down here in Tampa, when it gets to the 70s overnight, they start breaking out the winter clothes.
Yes, yeah,
Right.
right. They put their puffies on.
Yep, the puffies come out.
Yeah.
Right. That's pretty funny.
I don't know why they allow anyone to sell them in Florida, but they do.
Imagine that.
Well, I guess they'll just let them sell anything they want.
Right.
Okay, well, I
right,
think we
Board of
should
Health.
pack it in here and.
All right, well, go Red Sox.
What?
Yes.
Right. And have a safe drive home, Arlene.
Yeah, be
Okay.
careful.
When do you
good-
leave, Arlene?
Well, Cliff's coming down on Saturday and
Oh, good.